Hi, my name's Anna Middleton. I qualified as a dental hygienist in 2015 and most recently as a dental therapist in 2021. I work in 2 practices in London, and I'm also the founder of London Hygienist, which is my independent dental business that I founded to change the way oral health care is delivered to the public and improve access to dental services. With the evidence base continually growing, it is fundamentally important for dental professionals to stay well-informed and know how to distinguish between robust and weaker information, and understand when, why, and how to amend any clinical practices. I like to keep up to date by making sure I complete various CPD courses, attend relevant events, and being a member of societies such as the BSP and BSDHT. Professional knowledge is important in the application of guidelines, and being able to critically evaluate that information is how I make my decisions. And to do that, I refer to the grade system assigned to the evidence. It can be challenging at times to stay ahead of the curve, and our advances in science and medicine are continuously evolving, and I would actually say even at a more rapid rate than before. When you have new information to process and appraise, it can take time to evaluate the quality of the evidence, as well as knowing how to implement that into practice. To stay up to date on the best possible information and put it to good use, ensure you're a member of relevant societies and try to attend as many courses and events as possible. Talk to your peers and make use of the professional forums and press resources we have available to us. While practicing evidence-based dentistry, I believe it is still important to remember that we treat individuals. So therefore, we need to be able to adapt accordingly to ensure that we're providing the best possible care to our patient and their needs, which effectively can change all the time while they're in our care. For example, I qualified in 2015, and already there have been changes in guidelines and evidence from when I was training, such as the spit don't rinse message. It was really helpful to have the Hygienist Advisory Panel led by Professor Chappell and Professor Deary. They helped us understand how and why the evidence has changed and what that means for us and how we manage our patients' oral health, while also providing us with professional development in how to appraise evidence in the future. It's really reassuring to know that applying a more multi-dimensional approach to patient care is how we should be practicing, and not just sticking rigidly to applying potentially outdated guidelines, and to keep reviewing our practice as well as our patient needs at every visit. So for example, if a patient presents and their oral hygiene has slipped, we would naturally remind them of best oral hygiene practice. But what if for a particular period of time, we introduce adjuncts to support their present needs and then review again at subsequent visits? It was really exciting to see the research and evidence that is emerging around chemical adjuncts to support better oral health. Life is in a constant state of flux. What suits one patient one day might change the next day. When patients come to see me, I use information gathered at that appointment, such as their bleeding score, their stress levels, the fact their electric toothbrush has stopped working, along with anything else they may share with me. Based on that information, I then will decide what is the best advice and treatment for that patient today. When I see them next time, I'll review and make adjustments accordingly, while all the time co-signing my decisions back to strongly based evidence. I share new information with patients face-to-face in clinic by explaining why they may have a certain oral condition, what can be done to manage it, and why I'm giving them the advice I am. I'm also passionate about sharing information on social media to help educate and support patients who may not be personally seeing me. I think for me, I'm in a fortunate position where patients book with me under direct access. So these patients are already independently seeking a clinician to meet their needs. This means that we almost go on a journey together, as I'm always learning and evolving, and it's exciting as they're inquisitive and they're open to the advice because they're taking an internal locus approach to their well-being. And while this may not be the case for everyone, the point is that through the right forms of communication and motivation, we can make a change. And that's what really excites me about being in dentistry and being a part of the Hygienist Advisory Panel.